Good morning, everyone. Welcome to our first webinar for the year 2024, celebrating MeMoSA and oral cancer detection app. We all know how technology is rapidly changing the world. Leveraging on mobile technology and AI, MeMoSA was built. Today, we speak to the two great minds behind MeMoSA, Professor Dr. Cheong Sok Ching, Deputy Chief Scientific Officer of Cancer Research Malaysia, and Dr. Noor Shalin, Co-Principal Investigator from Ministry of Health Malaysia. She's an oral medicine specialist based in Sarawak. Welcome, Prof. Cheong and Dr. Noor Shalin. How are you all doing today?
Hi, Vishala. Good morning, everyone. Great to be here.
Hi, Vishala. Good morning to everyone. Hi. Nice
Hi.
to see you.
Okay, so without further ado, I'm going to share my screen. Okay. Prof. Cheong, let me start with you. Please tell us what is MeMoSA and what is the latest update of MeMoSA?
Hi, good morning, Vishala and everybody. I'm really feel very privileged to be occupying your first podcast of 2024. And with me, I'm really pleased to have my colleague here, Dr. Noor Shalin. So a little bit about what MeMoSA is about. So MeMoSA is actually a mobile phone application that Cancer Research Malaysia has developed. And this mobile phone application operates on a mobile phone and enable images to be taken and sent to a clinician remotely to get a preliminary diagnosis. So what this then enables is to facilitate early detection of high-risk lesions and oral cancer, even for people who may live far away from a dental clinic.
And what is the latest update on MeMoSA?
So we're really excited to give some updates because MeMoSA has just been implemented in several villages in Sarawak, and this has just happened only a few weeks ago. And what's going on in these villages is that community healthcare volunteers, which means these are the people who live in these communities themselves, have volunteered and are using MeMoSA to help their communities to look for oral lesions and oral cancer. So these lesions may be detected early. So we're super delighted that a tool such as MeMoSA can actually empower early detection of oral cancer at the community level.
That's very cool, a mobile app to screen for the early detection of oral cancer. Imagine how easy will it be to have the device right in your hand, making early detection easier, therefore also increasing survival. So, Prof.
Yeah,
Cheong,
exactly.
tell us more on the launch. Where will it be and why did you select that location?
So you've heard about the launch, Vishala, which again, we are super excited to tell you that MeMoSA will actually be launched by the YB Minister of Health, Dr. Zulkifli, on the 25th of February this year. So in just a few weeks' time, and I think it will be about a week after Chinese New Year. Yeah, and this will be done actually in conjunction with the closing ceremony of the Mouth Cancer Awareness Month that will be happening from the 4th of February in conjunction with also World Cancer Day. And the launch by Dr. Zulkifli will be held in Samarahan, which is one of the divisions in Sarawak. And you also asked me why did we choose to launch where we are going to launch. This is because, as I mentioned, MeMoSA is currently being used in Sarawak, and we designed our work this way as the distribution of dental clinics are not uniform in Sarawak, where people living in some parts of the state would find it hard to reach a dental clinic. And MeMoSA will make the most difference in this community by connecting people from this community to a clinician, despite not having one physically on site.
Yeah, so it's like basically making healthcare accessible to all despite their socioeconomic background.
Correct, exactly.
Okay, Dr. Noor Shalin, this question is for you. You see patients with oral lesions and cancer day in and day out and you diagnose them. Could you share some of your current challenges?
Thank you, Vishala. First of all, I would say thank you for asking me to join this webinar with Prof. Cheong. Yes, we're very excited about this project. Now, I think as Prof. Cheong has just mentioned just now, logistics is a major problem in Sarawak. There's uneven distribution of the dental clinics. So one of the main challenges for these cases are patient not turning up. Whether they don't turn up at all or whether they turn up at a different time than the appointment that you gave. All right. So we hope with this will provide better access for the patient. The other challenge that we face daily is patient is unaware of the lesions. As you know, most of the lesions, they are not painful. So because it's painless, patients are not keen to attend the clinic because they don't know it's there and it's not causing them pain. And so it's a bit difficult to get patients to understand what they have. Sometimes you really need to educate. And because of lack of awareness of the lesions or lack of pain, patients sometimes defaulted their follow-up. For early lesions, you would regularly follow them up, but because it's painless, they don't follow up. Also partly logistic and partly of awareness. Now, the other challenge that we have is patients are reluctant to have any treatment done. Again, pain is not a big major factor in that. So because they said it's not painful, why should you have anything done? All right. So I think awareness, lack of awareness is a big major factor in understanding this lesion.
Okay, so Dr. Norshalin, I think you have also explained how MeMoSA will be beneficial in areas like Sarawak, because you say challenges in accessing care, and then there's lack of dental clinics. But I would also like to understand, how do you think this app will help the healthcare system and other clinicians like yourself?
Yes, like I mentioned just now, with MeMoSA, we hope to provide better access, as logistic is a major problem, especially only available in major towns only. And but I think it also helps them if you look at the point of view of the dental officers, the healthcare workers. Now, these dental officers, they are scattered throughout Sarawak. I'm taking Sarawak as an example here. And with the app itself, they will be able to make better clinical decision for the patient. Yeah, because it's just at the fingertips. They'll send these pictures to the clinicians, and the clinicians will be able to view and give them better advice. Instead of them just making the decision on their own, and they're not sure. And of course, logistic is a problem. If you can get better opinion from the clinician, then they will be able to guide the patient better, whether the patient can be monitored at the clinic itself or whether the patient needs to be referred to the specialist. All right. So this will definitely reduce that logistic problems for these patients. Personally, also, I feel that if you have this, and then the dentist is able to explain to the patient better what they have, it will also improve the patient compliance to the appointment at the specialist clinic.
Okay, thanks. Thank you for sharing. So it also, in a way, it also reduces the burden of the healthcare system. Am I correct?
Yes, that's true.
Okay, so there's basically two parts to it. One is two aspects to it. One is it's helping the community so that they can screen oral cancer. And the secondly, it helps the healthcare system at the same time.
Yes, it will hopefully with the app we'll be able to screen more patients, because right now, we are screening patients who come to the clinic, but we will have programs as well when we go out to the community to screen. But as you know, there will be limitations in the number of times. Now we have the app, and it's available to healthcare volunteers, for example, within the kampong itself, then you will have increased the number of people screened. And so you could increase the number that is screened for oral cancer. So hopefully we'll be able to detect these cancers at an earlier stage.
Correct. Thanks. Thank you, Dr. Norshalin. Prof. Chong, this question is for you. What was your earliest memory of MeMoSA, and how did the idea come about?
Well, the idea of MeMoSA came actually quite a few years ago, but the name MeMoSA was coined only, fairly recently. And the idea actually happened in Sarawak, and I was actually with Dr. Norshalin herself, and also another colleague of ours who is in dental public health, Dr. Thaddeus. And I was really lucky to be able to tag along with them as they went into a remote village in Sarawak called Marudi. And Dr. Norshalin alluded to this, that they actually do this routinely. They go into these villages to ensure that nobody is left out. So if there are no dental clinics, then that's what they will do. They will have field trips to go out. And like I said, I was lucky to be on one of these trips with them. And at that time, MeMoSA obviously did not exist. And I was working with our scientists in Cancer Research Malaysia in the laboratories, actually identifying genetic changes that will ultimately help us develop a cancer vaccine. That cancer vaccine is quite far along the development pathway now, and it is poised for clinical trials. But at that trip, it dawned on me that even if we had the best treatment, if patients are not able to be diagnosed early, they would not benefit from any cancer treatment, as their cancer would be too far advanced. That's when I proposed the idea of teleconsultation and MeMoSA to Dr. Norshalin and Dr. Thaddeus, and they were excited. And as they say, the rest is history. So we built on that idea, and we developed MeMoSA to where it is today.
That's very interesting. I like how you started your work with, with some molecular genetic study, but instead how quickly you understood the underlying challenges when it comes to oral cancer detection and realized that having the right treatment alone was not going to solve the issue.
Yeah.
And we first need to tackle the challenges, and you leverage on technology to facilitate equitable healthcare, and that's how MeMoSA was born.
Right.
Very nice, Prof. Chong. Dr. Norshalin, this is for you. See, you also train volunteers who are on ground on what abnormalities they may encounter in their mouth. Can you share your experience? How do you conduct such trainings when the volunteers do not come from a medical background?
Yes, we had our first training session last December. It was very interesting. I think all the volunteers were very excited. It was a very engaging session. I have been training dental officers for detection of oral cancer for many, many years, but the training module that we have for volunteers has to be different from this for the dental officers because their level of knowledge should be different. Now, for them, I employed the format of having short lectures just to explain what are the risk factors, what cancer you have, and but also I use clinical pictures because I think pictures will tell you better than words. All right, picture tells 1,000 words, as you say. So we use pictures to educate them. For healthcare volunteers, you just need them to understand that there is something going on. Just need to teach them to understand the mouth, what's in the mouth, right? So they just need to know whether the lesion is present or absent. They do not have to give a proper diagnosis because this will be done by the healthcare professionals at the other end of the app. And so they did very well, I must say, because we did a pre-test before the training and we did a post-test after the training, and there was an increase in the scores that they, and they performed very well. They could understand that there are lesions present and there are lesions absent. So this is the most important thing, is to understand your mouth better. So that was the target of the training.
So these volunteers are people from the community itself?
Yes. The volunteers are not healthcare professionals. They are from the community itself. A few are healthcare professionals, but they're not within the dental profession. They are part of from some of the villages. They are part of what you call the JKKK Kampung, Jawatan Kuasa Kemajuan dan Kebajikan Kampung.
Oh, okay, very nice.
Yes, I think every kampung has this committee. They're made up of different members of the committee. And like I said, it was a very engaging session. You may see inside the pictures that you've shown. They're very excited because it's something new to them. They don't know much. And so when you teach them, they get very excited and they can help and do something for the community.
Correct. It's interesting, right? The community now coming together and they themselves empower their people so that people get screened for oral cancer. That's very nice. So, thank you, Dr. Norshalin. Prof. Chong, we have spoken how the idea of MeMoSA came about, how you and your team want to use this app to tackle the challenges on ground when it comes to early detection of oral cancer. So, as a person who has seen MeMoSA since its infancy, how do you feel now that you're finally ready to launch this app in a grand scale?
So we're very encouraged with the work that we've done with MeMoSA, and this is not only at the level of Cancer Research Malaysia, but also at the level of our extended team, which includes our clinical colleagues at the ministry and our other collaborators in different fields. So I'm really delighted that the healthcare volunteers in every community we have worked with have really embraced this. And if you imagine, these are people who have to make a living, right? They have a day job and yet they volunteer their time to ensure that the communities benefit from this technology. And I hope that we'll be able to sustain this so that it's actually really a shift in the paradigm of how healthcare is delivered. And because of technology, these volunteers don't actually need to be trained to the point of being a healthcare professional, but yet they can empower themselves in order to help their community. So it really is a big paradigm shift of how healthcare is delivered. And I'm really hugely motivated by our clinical colleagues, the patient advocacy groups, such as the Society of Cancer Advocacy and Awareness in Kuching or SCAN, and the Malaysian Dental Association, who are all on board as partners on this project. With this team of people, I think we can really make a difference.
Yes, yes. Normally it just used to be a doctor or the nurse and the hospital, but now you have an added layer of the community coming together. So it's a better reach, right? So it's nice to see the community is so playing an active role in this, especially when the team behind MeMoSA has thought through and put so much of effort, in fact, their heart and soul in making this possible. And now when others join hands and are as equally as excited as you are, this is all going to be worthwhile.
Yeah.
My next question to you, Prof. Chong, and Dr. Norshalin as well. Where do you see MeMoSA growing from here? In short, what are your hopes and dreams for MeMoSA? Maybe Prof. Chong, you want to go first?
Sure. We certainly want to expand this to benefit more people and also expand this to benefit communities outside of Sarawak. But this will take more resources, of course, and the more resources we have, the more we can do. It really takes a team to ensure patients are detected and treated early. And if I know there are many people listening in, we're really pleased that this podcast or this webinar has really been very engaging in terms of getting people on board. So if this resonates with you in the audience, please do reach out to us and find out from us how you can help. Yeah.
Dr. Norshalin?
Yeah, I guess my hopes and dreams for MeMoSA is similar. I hope not only the healthcare workers will be able to adopt MeMoSA, the use of MeMoSA regularly, but also the community. Now, we want to empower the community to help us healthcare workers to screen more, all right? So if they can find an easy tool for them to help within the community, so then I'm sure MeMoSA would achieve its dreams and goals. At the moment, MeMoSA is still taking baby steps. Hopefully, we'll reach there, yeah, Prof. Siong.
Yes.
Yeah, because I think MeMoSA can be used as a tool for early screening within the community. And hopefully, we gather enough information on it. We'll be able to develop an AI, probably use technology now. And with that, we will be able to increase the accuracy in detection of this lesion, and of course that will translate as a reduction in cancers detected at stage 3 and 4, and so of course it will probably translate into better survival for these cancer patients. And it will not make oral cancer becomes this big scary monster anymore. It will be more manageable for this.
Correct. Yes, yes. It'll become a disease that people are less fear about because there are available tools for early detection.
Exactly. I mean, the mouth is very easy. I mean, like unlike other cancers, it's easier to look inside the mouth, all right?
Correct.
Other parts of the body, there are other issues, you're not, when you go and see the doctor, you're not open to discuss certain things.
Correct.
But the mouth is very easy. You can just stand in front of the mirror and have a look in your mouth. As long
Correct.
as- Exactly, isn't it? Yeah, open up and say, and you can see everything. So, but if you understand what's in your mouth, then you will know what's going on inside the mouth. And we hope with MeMoSA, you will be more, it will be easier for you to understand what's going on inside.
Correct. And the mouth is the organ that you use every day,
Yes,
speak,
yes, it's true. A
Yes.
very important organ, I must say.
Yes, yes. So it's very nice and it's inspiring to hear from the both of you. Dr. Norshalin, this question is for you. I've conducted many talks in regards to MeMoSA, and a lot of times people ask me this question. So research has shown that oral cancer has more than 90% chance of survival if detected early. People are curious, what can they do to detect and diagnose and treat earlier? Could you share some of your advice on early signs and symptoms of oral cancer?
All right. I must say, oral cancer, some of the early signs include non-healing ulcer. Okay. Now, when you have a non-healing ulcer not hasn't healed in 2 weeks, it's best to get an advice from a professional and seek treatment of it. It might still be an ordinary ulcer, but it can be something more sinister than that. I think I've mentioned this earlier on. Pain is not an early sign. Usually, pain is the last sign. Okay, when it's painful, it means that that lesion is big already and it's involving the nerve. So that's why a lot of the cases, they do not come early because it's painless. Yeah. Presence of white, mixed red and white or red lesions, as I think you will see on the screen here. This is what we call oral potentially malignant lesions or disorders. Now, these are the lesions that when you've been diagnosed with this lesion, individuals who have been diagnosed with these lesions, they have a higher risk of developing cancer, whether it's within this lesion also or anywhere inside the mouth itself. Yeah. And and other signs and symptoms, rapidly increasing swelling in the mouth. That's more sinister. When your dentures don't fit anymore, something's growing inside your mouth, as you please go and seek a dentist, professional advice. Any numbness, any sudden loosening of teeth. Now, these are very sinister signs. So any swelling in the neck. Now, once there's swelling in the neck, it means that the tumor has advanced a little bit more. Yeah,
it's spread a little bit more.
Yes, yes. So you can see in the pictures some of the, on the screen, some of the pictures showing early signs of oral cancer. Now, I think this picture is showing cancer itself. So cancer itself has many different presentation. It can present as an ulcer, it can present as a swelling, it can present as a white lesion. Okay. Now, usually when it's at advanced stage, it's usually this large swelling or this very large ulcer. All right.
So, Dr. Roshalin, I have a question for you. I mean, people have asked me this question, okay? If I drink hot water, can I get oral cancer?
Oh, hot water, no. No. Oral cancer, the risk factors are very similar to other risk cancer, smoking. Yeah, in our parts of the world, we still have people who are still chewing with the quick.
Yes.
Or any tobacco-related products. These are the risk factors. Excessive drinking of alcoholic drinks. But I think now we're also seeing increasing trend in those who do not have all these traditional risk factors.
Correct.
Infection has such as human papilloma virus have also been associated with oral cancer. Excessive exposure to sunlight can cause cancer on the lip, basically.
Okay, interesting. So this will be my final question to the both of you for this webinar. Anyone that you would like to thank that you see MeMoSA being implemented and ready to be launched? Prof. Chong, maybe you want to go ahead first?
How long do you have, Vishala? I'm so grateful
That's a long list.
Yes, I'm so grateful to so many people and organizations for bringing MeMoSA to where it is today. And of course, we must thank our Ministry of Health partners, all the way from the administrators and the leadership of the Ministry of Health, to all our dentists on the ground who's actually participating in these studies. Our funding came from quite a few sources. I would like to thank the Ministry of Science, Technology and Innovation for providing funding via the Academy of Sciences and also CREST. Research Malaysia also provided funding from us and for us, and more recently, the German Embassy in Malaysia also supported different parts of our program. So different funders would have different mandates in terms of their funding, and this really helps us roll out our programs. And I must also record my thanks to Yayasan Saim Dhabi and Yayasan Petronas, who have been long-standing funders of Cancer Research Malaysia, and each and every one who have supported us financially and those who rooted for us, because guess what? Every little bit counts, you know, for us to get to where we want to get to.
Correct. Dr. Norshalin, what about
Yeah,
you?
I think Prof. Cheong has said the whole list of it. But I must say, I would like to thank Prof. Cheong first of all and her team for developing MeMoSA, because if not, we would not be starting this project on MeMoSA. I would like to thank the Ministry of Health for their support and for allowing us this opportunity to start this project in Sarawak. I would like to thank the volunteers and also the primary healthcare providers, because I think without them, we, the specialists at the other end of MeMoSA, will have nothing to view, because I think we really need the support of this. And my last I put big to the community itself, because I think without the community, we will not be able to do any screening at all. Without the community being part of this project, is everyone in the kampong itself who has played their role in the small role in being screened. And the people who are screening it, the people viewing it, and these are the people who will make MeMoSA achieve its dreams. So I would thank all these people.
Correct. You know, it's nice to see the community coming together and different stakeholders coming together to make this successful. And this is only possible because of the donors who believed in MeMoSA. So as a non-profit organization, this work was possible because of the research grants and donations that we received. So do check out our website through this QR code, and to learn more about the work we do and learn how you can join forces with us to create a future free from the fear of cancer. Please scan and give us your feedback, how you feel the webinar went today, what kind of topics you would like to hear. We would really, truly value your feedback. So I'm going to open up the floor for a 5 minutes Q&A. Okay, let me see. If there's any questions, you could ask the questions. There's a chat box. You can actually drop your questions. Okay, so why is MeMoSA focused in Sarawak? Is oral cancer less here in Peninsula? That is the question.
Maybe I can start answering that question. So that's a great question. As I mentioned before, MeMoSA started in Sarawak because of the kind of non-uniformly distributed dental clinics. But in addition to that, the reports from the National Cancer Registry also indicated that some indigenous groups in Sarawak actually are at higher risk of developing oral cancer based on certain risk habits.
Okay, thank you. Thank you, Prof. Cheong. Is there anything you would like to add in, Dr. Norshalin?
No, I think Prof. Cheong has covered.
Okay, thanks. Let me see if there's any other questions. There's no questions. Anyone has any questions? You could just put your questions down. Let me just check if there's any questions on the Facebook group. Questions as well.
Vishala, there are people who have kind of raised their hand, but I'm not sure if you allow, I think it's raised hand, right? if I'm
Yes,
not
yes,
mistaken,
yes.
under participants, but I'm not sure if they are muted or not. Yeah.
Okay, just give me a minute. Let me just check. Yeah, they are all muted. Let me see who raised their hand so that I can.
Yeah, maybe they can type their questions
Yes. Please type
in
your
the
questions.
Q&A. Yeah.
If now is considered a baby step for MeMoSA, what is your long-term plan for this app? That's the next question.
Okay, the long-term aim for MeMoSA is for us to be able to have this in all the communities, right? So that we then able to really get screening equitable to everybody who has a smartphone within the village. So that's the dream, that we can have MeMoSA widely used in every corner of the country. But in order to get there, of course, this is a healthcare app, and we cannot risk, detecting cancers that are not there and then clogging up the whole Ministry of Health system. And on top of that, we also have to be really careful, because technology can work both ways. It can close the gap of healthcare. It could also widen the gap, right? Because when people are fearful of certain aspects of technology. So as we roll out in the villages in Sarawak, we are also collecting data. We are also interviewing the users of MeMoSA to understand what is their acceptability level and whether it's feasible. And what are the gaps that we still have to close before we roll this out in a larger scale.
Okay, thank you, Prof. Chong. I will try to unmute those who have put up their hands. Okay.
There's one more question here, I think, or two more questions. When
Yes.
this app is launched, who can use the app? So currently, as I mentioned, we are still collecting data on how widely and in what fashion we can roll out MeMoSA in the next phase, the scale-up phase. So at the moment, the app is being implemented within the realm of the Ministry of Health. Yeah.
Okay. The next question is, do you have any plans on launching similar apps like MeMoSA for other types of cancer?
We actually do have other apps that are developed in Cancer Research Malaysia. So we have another tool called Erica, which actually calculates the likelihood that you actually have a BRCA1 and 2 mutation. But not a similar app it is not a similar app like MeMoSA. It doesn't take pictures, but it asks you a list of questions. So yes, we do have other apps that are already being used in different communities, but it wouldn't be exactly the same, because each cancer will require different requirements, right? So for example, for MeMoSA, a big part of it is taking pictures because the lesion is accessible.
Okay. So I think that's the only questions we have for today. So this is okay. So we're having Terry Fox Run Malacca 2024 on the 24th of February at Malacca River Cruise. So, with a donation of RM40 ringgit, you get a Terry Fox Run t-shirt. And if you do not know who Terry Fox is, he's actually a Canadian. If you can see, he's wearing the prosthetic leg, right? So he actually had cancer. And his aim when he walked across Canada was to raise the awareness of the importance of cancer research. So when you join this run, the funds will be channeled to Cancer Research Malaysia so that we can continue doing impactful research on Asian cancers. So please join us. Malacca is just 2 hours away. There's lots of foods that you can have there as well. So do join us in Malacca, and we can just take a scan of this QR code here. It takes you to the registration page. Okay. Thank you, Dr. Noor Shalin. Thank you, Professor Cheong. It was great talking to the both of you. All the best for MeMoSA. Very inspiring to hear the story of how it just started with the idea and now it's come to a fruition. So all the best to the MeMoSA team.
Thank you, Vishala. Thank you, everyone.
Thank you, Vishala. Thank you.
Thank you. Take care, everyone. And thank you, everyone, for joining us today. Thank you.